There is a moment in modern healthcare that looks almost ordinary on paper. A routine checkup. A scan. A doctor saying, "We need to look closer," and suddenly, a simple appointment turns into one of the most emotionally complex journeys in medicine. That is often how breast cancer enters people's lives. Quietly. Without warning. Not as a dramatic event, but as a discovery inside a system designed to detect it early. And that system is one of the most important and expensive global healthcare networks ever built. Because breast cancer is not rare. It is one of the most commonly diagnosed cancers worldwide, affecting millions of women every year, and in some cases, men as well. But the strange part is this. Even though awareness has increased massively over the last few decades, the global impact has not disappeared. It has only shifted. Earlier detection in some countries. Delayed detection in others. Different outcomes depending on geography, income, and access to healthcare. That's the uncomfortable truth behind modern cancer screening programs. They do not exist equally everywhere. In high-income regions, mammography screening programs are often widely available. Regular screening helps detect tumors at earlier stages when treatment is more effective and less invasive. In lower resource regions, screening may be limited or inconsistent, which creates a global imbalance. Not in knowledge, but in access. And access is where healthcare becomes economic reality. Because every screening program costs money. Machines. Trained radiologists. Hospitals. Maintenance. Public health funding. Insurance systems. Behind every scan is a financial structure supporting it. And that structure determines who gets early detection and who doesn't. Now here is where the story becomes more complex. Breast cancer is not a single uniform disease. There are different types, different growth rates, different biological behaviors. Some tumors grow slowly over years. Others develop aggressively within months. This unpredictability is why oncology research focuses heavily on classification and personalized treatment. Because medicine is no longer just about treating cancer. It is about understanding which version of cancer a patient has. And that changes everything. Treatment options may include surgery, radiation therapy, chemotherapy, hormone therapy, and in some cases targeted drug treatments. Each option carries its own cost, its own side effects, its own survival probability, and its own financial burden. Because modern cancer care is also a financial system. Hospitals calculate costs. Insurance providers calculate coverage. Families calculate affordability. And patients often sit in the middle of those calculations while making life-changing decisions. That is the invisible economic layer of global breast cancer treatment systems. And it is massive. But there is another layer people rarely talk about. Time. Because breast cancer outcomes are heavily influenced by timing of detection. Early-stage diagnosis often allows more treatment options and better outcomes. Late-stage diagnosis limits choices and increases complexity, which makes early awareness campaigns incredibly important. But awareness alone does not guarantee action. Many people still delay screening due to fear, cost, or lack of access. And sometimes simply because life is busy. That delay is not irrational. It is human behavior. Modern society is overloaded with priorities. Health often becomes something people check later, until later becomes too late. And this is where the healthcare system reveals its uncomfortable math again. A single delayed diagnosis can shift treatment costs dramatically. From manageable outpatient procedures to long-term intensive care. From localized treatment to systemic therapy. From lower cost to extremely high cost. So prevention and early detection are not just medical strategies. They are also economic strategies, because catching disease early reduces long-term financial strain on both families and healthcare systems.
Once breast cancer diagnosis is confirmed, the system shifts into a different phase entirely. Not discovery, but decision-making. Doctors begin mapping treatment pathways based on tumor type, stage, patient health, and genetic factors. This is where modern medicine becomes highly personalized and slightly overwhelming, because there is really only one correct answer. There are multiple possible routes, each with trade-offs. Surgery may remove the tumor. Radiation may reduce recurrence risk. Chemotherapy may target fast-growing cells. Hormone therapy may block cancer signals. Targeted therapy may attack specific biological markers. Each option comes with different costs, different timelines, and different side effect profiles. And patients are asked to understand all of this in a short period of time during emotional stress. That is one of the most challenging aspects of cancer treatment systems. Information overload under pressure. Meanwhile, global pharmaceutical companies invest billions into breast cancer drug research, especially targeted therapies and immunotherapy advancements. Over the last 2 decades, survival rates in many regions have improved significantly due to earlier detection and better treatments. But improvements are uneven globally, because access still depends on healthcare infrastructure, insurance coverage, national policy, and economic stability. Which brings us back to the core issue. Modern cancer care is not only about science, it is about distribution. A treatment that exists in one country may be inaccessible in another. A screening program available in one city may be absent in rural areas. And that creates a global healthcare gap that is not always visible in headlines, but very visible in outcomes. At the same time, breast cancer awareness campaigns have played a major role in shifting public behavior in many parts of the world. More people now understand the importance of early screening, self-check awareness, and regular medical consultation. But awareness alone cannot fix infrastructure limitations, because awareness without access still leaves gaps in care. And this is where healthcare becomes a system problem, not just a medical one. Hospitals alone cannot solve it. Doctors alone cannot solve it. It requires policy, funding, education, and long-term planning. And even then, the system remains imperfect. Another layer often overlooked is emotional and financial strain on families. Cancer care does not only affect patients, it affects caregivers, income stability, work schedules, long-term savings, education plans. Entire household structures can shift during treatment periods. Which is why in many countries, health insurance systems play a crucial role in determining how manageable treatment becomes. Where coverage is strong, financial pressure is reduced. Where it is weak, families may face long-term economic consequences. That is why breast cancer is not only a medical condition. It is also a socio-economic event. A medical crisis that interacts directly with financial systems. And this interaction is global. Despite all this complexity, there is one quiet fact that remains consistent across regions. Early detection saves lives. But early detection depends on awareness, access, and system readiness. All three must align. And that alignment is not guaranteed anywhere in the world. So even as technology improves and research advances, the global challenge remains partially unsolved. Because the science of treating breast cancer is advancing faster than the systems delivering that science seeks.